Good afternoon and good evening. My name is Avi Felli, and I'm the advisor for digital economy policy at the European Union Delegation to the United States in Washington, D.C. I will be your moderator for today's discussion, COVID-19 contact tracing apps, Frontrunners in Europe and the United States. So thank you for joining us today. Before we get started, a few housekeeping items. This conversation we're having today is on the record, and there are members of press in virtual attendance. Only speakers will be visible during the webinar, and all participants will be muted. However, we encourage you to be interactive, so please feel free to ask questions at any time via the Q&A function or the chat function located at the bottom or the top right of your screen. Please include your name and affiliation when you ask a question. If you are a member of the press, please be sure to denote this with your question. We have an excellent lineup of speakers today. I'm very excited to begin this discussion. I think it's extremely timely and we have the right people involved. So from California, we have the Honorable Eleni Kounalakis, Lieutenant Governor of California, who is leading California's efforts to identify and limit COVID-19 cases with their new initiative, California Connected. From Brussels, we have Director Jakub Boratyński, who is the Director of Trust, Society, and Cybersecurity in DG Connect at the European Commission. The director has been leading a coordinated European approach to COVID-19 contact tracing apps in Europe. From Berlin, we have Mr. Martin Stork, who is the Vice President of Strategic Programs at SAP, and he has been directing SAP's work on the German Corona Warn app, which was launched on the 16th of June. From Missouri, we have Mr. Jared Maslin, the Global Data Privacy Manager at Slalom. Slalom has been working in states, cities, and communities across America in their digital COVID-19 response efforts. So we're excited to have such great turnout for our webinar today, and we're actually going to start with a quick poll of the audience. So you should see a question pop up on your screen. Would you use a contact tracing app? Yes or no? And answers are completely anonymous. You have about 10 seconds to submit your own answer. About 5 seconds left to get your answers in. Okay, so we just closed the poll and we see the results. About 80% of you would use a contact tracing app and about 20% would not. So we'll see if any of the discussion today can change your mind. With that, it is now my pleasure to turn it over to the Ambassador of the European Union Delegation to the United States, Stavros Lambrinidis, for opening remarks.
Thank you. Thank you very much. And congratulations to all of you guys for putting this together. Now, the EU delegation in Washington, which is the EU embassy really, but we call it a delegation, is really happy to host this supremely timely discussion on contact tracing apps and other digital tools used in response to the unprecedented COVID-19 crisis. It is very clear to everyone that without technology, it will be very difficult to open up society to the degree that we all want to. And opening up our societies, our economies, is indeed what we want. In Europe, the freedom of movement is a cornerstone of European Union citizenship, and one of our primary achievements. And now with technology and the widespread voluntary take-up of tracing apps, we can support the relaxing of confinement measures and lift restrictions on citizens' freedom of movement, not only within Europe, but around the world. Technology can be a positive force in fighting this health crisis on both sides of the Atlantic. Now, keep in mind, contact tracing apps cannot substitute for masks, testing, manual tracing. All these things have to keep going on. But they certainly can complement and improve these efforts. We've seen results from Oxford University's Big Data Institute that if even only 10% of the population, here we have 80% in this virtual room, if only 10% of the population uses a tracing app, for every 1 to 2 users of the application, 1 infection could be prevented. Now, Dear friends, trust and transparency are, of course, the key to widespread adoption, which is crucial for success. People have to be safe using these apps. It is not okay for them to be misused, for people's movements to be traceable, even after the crisis is over. This, in fact, is one of the biggest dangers that we face today, even as we try to address the challenge of how are we going to be using artificial intelligence in the future. There are some countries around the world today that are using AI and apps in order to monitor their citizens and effectively to repress them if they so desire. That's not okay in a democracy. In a democracy, it is citizens who monitor the thoughts and the actions and the movements of the government, not the government that is supposed to monitor the thoughts, actions, and movements of their citizens. In the EU, privacy protections are enshrined in the EU's General Data Protection Regulation, the so-called GDPR, and the Commission's Tracing Apps Guidance that was published on April 16th, which my colleague from Brussels will explain in greater detail. And the EU's ability to pool resources and bring technologies together, frankly, has helped to enable the safe and speedy deployment of this technology across Europe. Now, after the publication of the Commission's guidance, Italy's Immuni app to trace COVID-19 infections was downloaded 2.2 million times within the first 10 days only of its launch, which was back on June 2. And Germany's Corona Warn-Up reached 13 million downloads within a week of its release in June. So we're doing our work actively to ensure that tracing apps are voluntary, transparent, secure, and perhaps most important, interoperable. Interoperable apps that work across borders could help overcome the coronavirus crisis and spark a long-awaited revolution in digital health. But you know what? We must learn from each other in how to deploy technologies to combat the virus. What works well and what doesn't. I firmly believe that we can make each other better, stronger, more capable of fighting this pandemic by sharing ideas and listening to each other. And this is what today's discussion in many ways is all about. You know, the world is fighting a pandemic and a daunting common challenge, and we can only beat the virus by working effectively together worldwide. So there's no better way for me to move into introducing the Lieutenant Governor of California, Eleni Kounalakis. You know, Eleni is a great friend and has been one for many, many years. She was the first woman to be elected Lieutenant Governor of California, which is a remarkable achievement and a very proud moment, I think, in the history of the state, and an inspiration to many of us in Europe as well. California is the site of 21 states combined, if you think about it, with a size and scale that is unmatched. And moreover, it is the home of Silicon Valley. And so California's approach to combating COVID-19 could help lead the way for other states, but frankly, for many in the world. Dr. Anthony Fauci said California has been ahead of the curve, quote unquote, in addressing the virus. And actions taken at the state government level have prevented California from experiencing a more severe pandemic. And at the end of May, California launched its own contact tracing program called California Connected. And while it is not a mobile application, it is a showcase of the use of digital technology to combat the virus. Before I give the floor to the Lieutenant Governor, let me just say that back in the late 90s, we did not have contact tracing apps. But if we did, maybe one of these apps would have shown 3 people, young people at the time, very young people, at least myself. Eleni is always young. Eleni, Jakub Boratyński, Marcos Kounalakis, and Stavros Lambrinidis eating together at a restaurant in San Francisco. You know, that meeting did not spread any virus, but it did spread love between Eleni and Marcos. They met in that restaurant and they got married, and that love is going strong so many years later. I am so proud to have been inadvertently a part of that remarkable story and history in Eleni's life. And with that, Lieutenant Governor Kounalakis, we are very honored to have you with us, and the floor is yours.
Mr. Ambassador, it is so wonderful to be here with you, and thank you for sharing that story. You know, back in the day, I was a confirmed bachelorette. My husband was a confirmed bachelor, and what you did, the magic that you brought, is just a testament to your ability to get many things done. So it's wonderful to be here with all of you because truly, Stavros, as you mentioned, the key to engaging right now in all aspects of combating the spread of COVID-19 is the ability to work together, not just state by state, not just states with federal government, but internationally with our European partners. So I'm really looking forward to this conversation and hearing from all the panelists. So just a couple of words about California and what we have been doing here. California was the first state to issue the stay-at-home order. It was a very tough decision to make, but it was clear based on the science that was being presented to elected officials that it was the right thing to do. We had no choice. But that early action was critically important in saving lives. To give you an example just of scale, we've had about 6,000 fatalities in California, every single one of them a tragedy, but we are twice the population of New York State, which has had now somewhere around 30,000 fatalities. So our early issuance of the stay-at-home order, people keeping people home, doubtless saved tens of thousands of lives. What it also did was it bought us time. And this is particularly important in the context of what's been happening the last few days, which is a recognition of a resurgence of the prevalence of the virus and a dialing back of some of the reopenings that we had done. So in the last 2 days, the governor has rescinded the opening of bars in California. We're going into the 4th of July weekend. We're urging people to take every possible precaution and to avoid crowds. We're closing beaches, etc. So this period of time between the issuance of the stay-at-home order and where we are today bought us time to do a lot of very important things. We added about 50,000 hospital rooms, hospital beds of capacity into our hospital system. We helped with our University of California and our biotechnology industry to develop therapies, including remdesivir, and do trials, clinical trials in our hospitals. We were engaged in the chaos around procurement of PPE and ventilators and protective gear. And all of this got us to the place where we have a backstop so that as we reopened, we could be sure that if there is a resurgence, as there is right now, that we would be ready for it. Of course, nobody wants a resurgence. And the other thing that we were able to do during this period where we bought time is recognize that as we reopen, we're going to need to develop testing and tracking. So people have heard a lot about that, testing and tracking. Our testing capability now is the largest in the United States. The last few days, we've tested about 100,000 people a day. Our positives are going up a little bit, and it is the contact tracing that now we are really relying on to be able to understand how and where the virus is spreading and under what conditions. So in that space, the way that we have primarily gone about our tracing program, our contact tracing program, is the old-fashioned way. Now, California has been using contact tracers for decades. We've been using it to trace everything from meningitis and measles to AIDS. And in fact, early on, as there were repatriated Americans coming from China, they came to California because we had so much of this capacity in place, being on the Pacific Rim, being very internationally engaged. So we had this capability, but we decided to invest in growing it. And that is what California Connected is. It was a goal of 10,000 additional trained contact tracers to do it the old-fashioned way, to call people, to text people, to reach out to those positives and find out where they were, how they might have gotten it. The technology that we're using is primarily, as these folks are being trained, giving them the ability so that they're not just using pen and paper, they're not just using maybe their own system that they develop to keep their notes and to collect data and file their data, but rather we started early on with a program with Accenture, Salesforce, and Amazon Connect, to be able to give the tools to these tracers so that as they are reaching out, first of all, they can reach people, and we're doing a campaign to encourage people, if they've tested positive, to answer the phone call of these contact tracers. And then we are having these folks, as they do their interviews, input the data in a way that protects the privacy of the people who participate, but also helps to organize that data in a way that it can be used to help us combat the spread. So I think it's very important to note that in California, this has been our primary investment, both in finding these 10,000 people, and we're at now, as of yesterday, over 10,000 people who have been trained. By the way, most of these people are already government workers. I love the fact that there are dozens of librarians who haven't been working, who've been retrained. They tend to be really good at asking questions and tracking down information. But many people from all different parts of government who had the bandwidth to go through this reskilling and upskilling program, and are now also equipped with the tools that Accenture, Salesforce, and Amazon Connect have given them to be able to do this work. So having said all that, I do want to acknowledge that I'm the governor's representative for international trade and investment. I have been talking to members of the diplomatic corps here in California, friends like you, Stavros, and others who represent their countries in Washington. And we see what's happening around the world with digital contact tracing. It is interesting. It is provocative. It is controversial on some levels. When people ask me about it, and they cite what is happening in China or India or Korea, that's one conversation. When you're talking about NATO allies, European partners who take privacy so seriously, more seriously than the United States federal government, and in California, as you know, Stavros, we talked about this, we're doing what we can to improve our consumer privacy protection here. But you have been the leader in the privacy space when it comes to technology. So the fact that so many countries in Europe are proceeding with this is something that I can say, to me personally, is very interesting, and it's very important to hear from all of you, to understand what is going on in these countries, how effective it is, what kind of challenges you're coming across, and also what kind of adoption that you're having through this voluntary program from your people. So thank you for having me, and I'm grateful to be here and really looking forward to the conversation.
Thank you, Lieutenant Governor. We appreciate that. I think there's so much happening in California, and as the ambassador said, and as you said, it's important to learn from each other. So with that, I'm happy to turn to Kuba, the director of the Trust Society and Cybersecurity group in DG Connect at the European Commission. Kuba, I'm hoping you could talk a little bit more about the work of the eHealth Working Group and what's going on at the EU level to ensure this guidance is provided for developing the contact tracing apps, and how you're ensuring that they are interoperable and safe, and what's happening at the EU space there.
Thank you very much, Evie, for giving me the floor. Good morning, good afternoon, ladies and gentlemen, and it's a real honor to be invited here by Ambassador Lambrinidis and to be part of this very important conversation. So indeed, I think we are sharing this destiny and these challenges across the world, and I think a lot has been said already about the whole context of this policy. Clearly, the contact tracing app are not a silver bullet, but they can be indeed a very important tool to support what has been always part of the classic response, epidemiological response to pandemic, that is the contact tracing. I think we have been all, back in March or maybe even February, observing with a lot of, obviously, we have been extremely anxious at the time about how, looking for different types of policy responses. There has been inspiration coming up from notably Singapore about potential use of technology in that context, and that indeed inspired member states as well as the Commission to move in this direction. For us, it was very important that we actually make a collective effort to avoid a fragmented and coordinated approach, which would ultimately hamper the effectiveness of those measures and would create a risk also from the point of view of internal market. So that was the reason why also, in response to member states' expectations, the Commission in April, exactly on the 8th of April, came up with the recommendation. And I have an honor to lead that effort, but I must say it was really an amazing effort of many of my colleagues, sort of working day and night to produce this. And the next step that basically our main recommendation was that together with the member states, we will produce basically an EU toolbox, which would provide guiding principles for how we would like to use the contact tracing apps. And if I can briefly go through those, let's say, four principles most important for this. The first one was that we really had to make sure that the technology is effective. It means it's well anchored into epidemiological guidelines and it's under control of health authorities. Secondly, that the applications developed in Europe are voluntary, extremely important from the point of view of the possible fears about very intrusive, privacy-intrusive nature of digital technologies. And it was for us very clear that if you want an update, it has to be very clear from the first moment that this is voluntary. And then we go into the privacy-preserving feature of these apps. That was also the reason why the Commission, in parallel with the toolbox that was developed with the member states, came up with the guidelines on data protection and privacy. Now, what it means in practice is that we wanted to ensure that all of this is in line with GDPR, the European Framework for Protection of Personal Data, widely known across the Atlantic as well, and obviously in California. We wanted to ensure that the measures that we would take, for example, prevent social stigmatization. The app work, among others, in a way that basically people who have been proven infected, get, that we follow their contacts. It was extremely important that we would instill a principle that these apps would be in operation only as long as they will be necessary, and then they will be automatically dismantled. And then finally, this is the critical aspect, is that these are tracing apps. So we are not tracking location of individuals. The solution was to actually base the application on Bluetooth technology, which means that what we are interested in is to follow the proximity, the potential contact between an infected person and the person who might have been exposed and therefore infected. We are not interested where this contact took place. So this is what have been really essential here, and also why we have also devoted quite significant time to the issue of ensuring the highest standard of cybersecurity. And finally, interoperability. The Ambassador Lambrinidis already mentioned that. For us, it is absolutely essential for the internal market, for the success of opening the internal borders, which, as you know, have been temporarily closed in Europe, that actually people can have their national apps and they can travel to other countries. So what has happened basically over the last 3 months was that, in the first phase, we have member states developing these apps broadly following the guidelines which were included in the toolbox. And Ambassador mentioned, one, I would say, probably of the 2 most successful examples in terms of uptake, Germany and Italy. There are a number of member states that are still in the process of rolling out their apps. And at the same time, and we have been working very hard on ensuring interoperability, we had basically reached recently, let's say, a final agreement between the member states on technical details. And actually, Martin Stock from SAP, who is with us, this was it was actually our German partners who have been very much behind defining the way we could have a European solution for privacy preserving way of ensuring interoperability by sharing so-called infected keys. So we are now basically at the stage of implementing the solution that has been agreed, so that basically in foreseeable future, we will have this interoperability up and running. Obviously, and I think we have to be very honest, we still ultimately don't know what will be the ultimate success of the contract tracing apps, what will be their uptake, and how effective they would be in supporting all the other measures, which of course are critical to contain the spread of pandemics. So all that work, because Evie, you asked, to tell about the eHealth group. Yes. So all that work is basically has been happening through almost sometimes daily meetings, of people across Europe, member states representatives in the so-called eHealth network that has been created before, obviously, the pandemics for the purpose of dissemination of digital technologies in healthcare, and specifically for tackling an extremely difficult issue that is the cross-border transfer of very sensitive health data. So that network was already there when we started this work, and these people have been extremely committed, to work with us. I would say almost on a daily basis, lengthy meetings, and this has been indeed very, very productive. So now we are in the stage of implementation. The piloting and testing would be extremely important before we could, because we are in a position to claim any sort of success, So we have to be, I think, modest and quite careful in not creating excessive expectations about what we do. But as I said, I think there has been very impressive way, an example of working together across the borders. And last but not least, we are in the international setting. I think the question of potential interoperability beyond EU with our important partners such as the US, I think we would also come. But of course, we have to take it step by step. So thanks again a lot, and I will stop here.
Thank you so much, Kuba. That's really helpful. I think it's important to maintain that perspective that what we do on one side of the Atlantic hopefully can be transferred to the other side and globally. So Martin, I know you've worked closely with the Commission and the German Ministry on the Corona Warn app. So can you tell us a little bit about that process? I know you decided to go open source about 2 weeks before the release of the app. Can you talk a little bit about that, and if you have time, how the app works?
Absolutely. But first, of course, I would also like to express my gratitude to be here. Honorable Ambassador, and also Lieutenant Governor, as European by heart, working for the largest European software company with, of course, strong business interests and presence in the US. For me, it's a pleasure to have those discussions with you. And also referring to Kuba, of course, we were working on a daily basis. Also, of course, I have to mention that T-Systems from Deutsche Telekom took the lead when it comes to the conceptual elaboration of our proposal. And now I hope we really very soon start to get into an operational mode here. And I'm really excited to see how the speed has changed in the collaboration between private sector and public sector when it comes to tracing apps, or when it comes to the management of the pandemic, right? So I think you have mentioned as well the fact that we decided to put everything open source, and this has also been a reaction of a predecessing project that has been launched in Germany, which was called PEP-PT, which suggested to store basically all the data that are necessary in order to perform the contact matching on the central server. And there was a very, very controversial discussion going on in Germany. And therefore, once the German government and the Federal Chancellery reached out to systems and to SAP to ask us to step in, we made this as a precondition that if we want to help, we need to reconstruct this foundational trust level, particularly amongst the most critical part of the society. And therefore, we have launched, I think it's the largest open source project in Germany, and you can all of you also the participants check this on GitHub. So we put great effort into this, really to interact very directly. Secondly, I think we really teamed up. Deutsche Telekom, SAP, the German Ministry of Health, but also in Germany it's the Robert Koch Institute, the National Health Organization, and Fraunhofer, our R&D organization, really to rally everyone behind this, right? So that we can work on the improvement of the measurement, proximity measurement performance, for instance, but also really leveraging the expertise of the RKI when it comes to the parametrization. And you know, if you are in the IT business, you have this waterfall and Scrum, agile mode, and I think for the first time we really started a Scrum project in conjunction with T-Systems with the German government. I'm really excited, and I would be really excited to continue to work in such a mode. Of course, also with the European Union, with whom we do have close ties since 20 years, right? But maybe let's go one step back. And you asked also about the overall, functional structure of the tracing app, and maybe I reflect a little bit on what does the app do and what the app cannot do or should not do, at least, right? So the app in essence is a warning app. That's his sole function. Warn users about exposure, contact exposure in the past, right? And the overall value proposition is that I think Cooper has mentioned, but also the ambassador, that it complements manual tracing efforts by providing decentralized, digital, scalable information to users at the one hand side, but also to health agencies, right? So how does it work in essence, right? So I think the only data which is stored in our backend are the identifiers of positively tested users. And those identifiers are pushed down to the devices of the users, right? And this is why we call it decentralized, because the matchmaking happens only on the level of the devices, right? So now the device of any users then sends temporarily identifiers which are pseudonymized and receive also respective signals from his respective counterparts, right? And if he has been in a range of 2 meters for a time period of 15 minutes, those are the parameters which need to be decided by the National Health Organization. So in Germany, of course, this also happens on the guidance of the World Health Organization, but this may change. Now, you may argue, for instance, if you go into a closed room, into a church, into a meeting room, in a further development and evaluation of this device, you might also apply 5 meters and only 5 minutes, right? But this is currently, of course, we as a technology company, we apply what has been decided. But if you have been for such a period of time in such a range, and you have met a COVID-19 positively tested individual, which has submitted his positive infection notification to the backend server, you will receive a warning, right? And in Germany, in order to simplify the whole matter, the health organizations have decided really to simplify and only to offer 2 risks, high and low. Yeah? But then you are warned, and in our UI, within this warning, of course, also comes a certain guidance on how to behave, to self-isolate. And I think later on in the panel, we will also discuss the adoption. Right now, as I mentioned, I think we are at 14.3 million. And one crucial element is also, of course, that if you receive a warning, you are eligible to take a test. And I think this is also important to know. And a tracing app doesn't make sense if you don't have sufficient testing capacities. later on, we might also discuss this false positives and that probably you identify more people than actually constitute a risk to you. If you do have sufficient testing capabilities, this is not an issue. There's a trade-off between true and false positives. But I think that this is something that, of course, I also want to confirm what Cooper and also the ambassador said. So the tracing apps will never replace manual tracing, right? It can complement this, but it needs to be integrated into a fully fledged pandemic solution. And our next endeavor, of course, is to provide interoperability, particularly for the southern countries of Europe. So Germany has taken over the chairman, the presidency of the European Union as of yesterday. And as the European German company, I think Deutsche Telekom and T-Systems, of course, we feel the responsibility also to contribute very actively so that our people can go to Spain or to Italy, and the app works itself. So I think from a technological point of view, also with a brilliant support of the European Union, which have orchestrated all the different ideas, which were already discussed. We had a consortium called DP3T amongst academics. So it was really nice to see how academics and the institution and business basically work together to work on a gateway server who will enable the backends to recognize and exchange identifiers of the home country and the country of interest, which would be the respective country of visit. Therefore, Kuba has also mentioned that we want to do this, of course, in a timely fashion, right? So we are, of course, also very, very committed and ambitious to continue this collaboration and also start execution on that once this is possible. Thank you.
Thank you, Martin. Before we go to our last speaker, I just want to remind those in the audience that you can ask questions via the Q&A function. So if you have anything on your mind, please feel free to raise it and be sure to include your name and affiliation. So turning to you, Jared, you've been working with Slalom in states, cities, communities across America on this COVID-19 response in a digital fashion. I'm hoping you can tell us a little bit more about the work that you're doing and also the policy environment that you're operating in. Obviously, it's very different here in the United States than in Europe. So eager to hear from you.
Thank you very much, Evie. And thank you to everyone for the opportunity to join you today. I'm excited to share some of what we've been seeing in terms of innovation in the face of COVID-19 and what we can learn from one another as we move forward together. I'd like to start by saying that the views I express today are my own and are in no way indicative of the views of Slalom or its clients. Now, there are a variety of approaches and techniques that have been developed across the United States. These solutions have ranged from anonymized aggregated dashboards that allow public insight into a state, city, or other municipalities' progress in flattening the curve, to more expansive mobile applications similar to Germany's Corona Warn app. Choosing between these approaches or mixing them together for a hybrid approach, as has been discussed, can really depend upon several variables, including population density, resource availability, and societal norms that help to form public expectations in the crisis. At scale, these societal forces shape what's considered acceptable or unacceptable for consumers, be it a perceived invasion of privacy or a collection of personal information for the public good. At the city level, we've seen dashboarding solutions be incredibly successful in sharing summarized data to the masses, offering glimpses into the performance of ongoing COVID treatment and prevention while still preserving individual privacy. We've also aided states in adopting manual contact tracing solutions, similar to the approach that the Lieutenant Governor kindly shared a few moments ago. While manually intensive, these solutions they offer a public direct line of sight into the data that's being shared and the data that's not being shared. This provision of control is really a common theme for many effective approaches, especially given the current sensitivity to privacy invasions across the United States. Whether through the creation of new infrastructure or through the utilization of customer relationship management or CRM solutions, these processes involve a heavy burden of experts, staff, and volunteers to bring to bear at scale. We've also been involved with mobile application development, finding systematic ways to capture critical data in a privacy-preserving and anonymized fashion. These solutions might employ Bluetooth technology for proximity tracing, perturbed GPS data for individuals via their smartphone or device, or a unique combination of the two. However, there's a tendency, especially within the United States, to perceive some applications as privacy invasions, resulting in low adoption rates in the single digits. Since the basis of these solutions is founded on tracing one's proximity or closeness to other individuals, the low adoption rate an application garners can lead to a much less effective tool in the end. This amplifies the criticality of consumer trust through transparency and control in how privacy is managed and how data is processed. Furthermore, it shines a light on the importance of inclusivity and designing solutions that reach the greatest number of individuals, regardless of their financial standing. With regard to privacy regulation, the United States has recently been following the lead of our colleagues in the EU. For example, many of the existing state laws, such as California's CCPA, and other proposed state legislation, including Washington State and New York, carry forward very common threads from the EU's GDPR, which is now in its third year of effective status. In a sense, the journey of businesses operating in the EU and their corresponding governmental authorities have been a model and a learning opportunity for the United States in finding the most effective way to address consumer privacy risk at scale. One clear point of differentiation for the United States has been the direction of states to determine their own approach in the absence of an overarching federal regulation to guide them. Privacy can often feel like a problem that needs to be solved in one sweeping motion, a single regulation to fix everything. But it's a challenge that continues to evolve as our society and our technology evolves. In that sense, privacy is very much like a moving target where the contextual integrity of the situation makes a subtle but profound difference. As a result, the solutions tend to be best suited to define a user-centric approach. They must stress interoperability, and best practices are guided by a combination of incremental regulations and nuanced consumer feedback. That's really a highlight, is this idea of driving based on consumer voice, on the public voice for what is acceptable. And finally, I want to recognize that we have an incredible opportunity here today and broadly. It's a chance to partner with our peers across the Atlantic and other public and private entities globally to learn from one another and to forge a common path for public good. This is ultimately our vision for the future as we work to redefine what's possible and create what's next together. Thank you.
Thanks, Jared. We've gotten a lot of questions from the audience, so I'm going to start pairing these with some of my own questions, and hopefully we can spend the rest of the time getting through them quickly. The first question I have is for you, Kuba. What's the importance of the voluntary aspect of the apps? And we know that India has mandated its citizens to download a contact tracing app. So why is the approach different here? Why the emphasis on the voluntary aspect? And then pairing that with a question from the audience. Is there a time or a point when the EU may require tracing apps to be downloaded, installed, and used by Americans for travel to Europe? And you're on mute, Kuba.
Thank you very much for this question. I think this is, simply a reflection of who we are. It's a question of attachment to our values, and definitely, in a situation when we want people to actually be collaborative, we want to avoid stigmatization. We need to make sure that actually, this part of the trust, we imagine if it was kind of enforced, policing this, in any case, there would be plenty of ways to actually, basically undermine this type of effort. So I think that was, I don't even recall that we had discussion about it. It was so obvious that this is how it should be. There have been no, let's say, dissenting voices on this. And I think that is the only chance for these things to work. I mean, we have a problem of trust in government across the world, across the Western world, and what we see actually that this is one of the ways to make sure that those concerns, are addressed. And I would even see that there is a certain potentially a correlation between the trust of citizens in government in general and their, for example, willingness to embark on such a technology. So stating it's voluntary, stating that these apps would be dismantled, being very clear about privacy dimension of this. This is the part of the whole package to make sure that people actually are ready to engage and use it. Now you asked me about, I think it's honestly really too early to say, how these issues of interoperability with other countries would work. But indeed, as I understand was suggested by the question, you can also imagine that the travelers would upload local applications. But I think still the questions of sharing of the data would remain. So as I said, I think the first step is that we need to make sure that interoperability works in Europe, that contact tracing apps are effective, and I think then we can go further. There is, in a way, a common basis, as we all know, that the model that has been chosen by majority of member states, the model on which Martin was describing, in so-called decentralized model, open, based on API offered by Google and Apple. So this is, I understand, the solution that is also being used in US. So from that point of view, there is a sort of a technological backbone that would potentially allow to go in this direction. Thank you.
Thanks, Kuba. Turning to the Lieutenant Governor, you've mentioned social distancing, washing your hands, all these good hygiene habits. Do you see contact tracing becoming a part of good hygiene habits in the United States broadly and specifically in California?
Well, I think Jared did a pretty good job at kind of giving a landscape for where things are across the United States. It does not appear as though the federal government is moving forward at this time with a program for the country. There are many states that are already employing some kind of version of this to lesser success, I think it's fair to say, than what you're experiencing in Europe. But I think that there are a handful of questions that are going to need to be answered about this, which is again why I'm so delighted to be able to participate and would love to hear a little bit more from Kuba and Martin and Ambassador Lambrinidis on this. But we've talked a lot about the privacy piece, and I think there's a knowable answer to that of how secure a person can feel in voluntarily participating. And I don't think Californians are afraid of technology. I think we're pretty early adapters of a lot of it. But there are other questions too. One of them is, how effective will these apps actually be combined with manual tracing? There are already questions about the Apple-Google API and the use of Bluetooth, and what happens if you're in a car and the person in the car next to you, you're stuck in traffic, your phones are nearby each other, but there actually is no exposure at all. So I'm curious to know how that piece is already working in Germany. Are you getting, are manual contact tracers getting flooded with information that they can't possibly follow up on? Do they have to add to their responsibilities sorting through the challenges of knowing whether there are parts of the data that they should be considering as what they should be following up on? That information, also knowable, is something I think would be really, really helpful in guiding states in the United States or even the federal government in knowing how helpful exactly and what are some of the challenges that the European Union countries are experiencing already in terms of the data that's collected and having that be valuable. And then the third thing that we care about a lot in California is equity. This is now underpinning every decision that the governor takes, every bill that the legislature looks at. How would this apply differently, work differently, support or help or hinder efforts in underserved communities? This issue has really broken wide open. And so I think that anything we can learn from the European process and countries within the European Union who are adopting this relative to how they might be disproportionately affecting underserved communities is also part of the information I think that we would be really interested in learning more about and understanding overall, Evie, as you ask whether or not this would be a protocol that would be right for California.
Thank you, Lieutenant Governor. Martin, I'm going to turn to you because I think we can piggyback off of the Lieutenant Governor's remarks on equity. I think there's some discussion in Germany still with the Green Party on whether or not this app is going to be a prerequisite for entering places like restaurants or shared spaces. Curious to your thoughts on that. And then I think secondly, back to the functioning of the app, I think if you could give some more clarification on some of the Lieutenant Governor's points as to what data you already have early on, or what kind of response you're getting to the app, that would be helpful.
No, absolutely. And I totally agree. And well, done is better than perfect, I would say. And this is something I learned from my US colleagues, actually, right? So I do believe that we need to learn while we walk in this crisis. And Bluetooth technology was not designed to perform proximity measurement at all, right? And therefore, I totally agree. And if two people kiss, for instance, it looks like there would be, at least from Bluetooth perspective, as there would be a huge water column between them, and there would be 4 meters apart, but actually they can't get any closer, right? So we are at 80% of accuracy. So we work very hard with Apple and Google. In the case of Google, this is really complicated because they have 15,000 different devices. Yeah? And Apple, they have, you know, some families of those iPhones. But then you really need to calibrate the signals, the attenuation measurement. We have done massive testing with our Fraunhofer Institute. Yeah? So we really build real use cases in the car, in the train, in the queue. And you have to go on and improve. And I think the question is also, of course, it's a living product. We will see updates. We will release. The next one is planned or scheduled for August, right? And you need to be ready also as an operator of such apps, yeah, really to incorporate this in the functionalities, yeah. So, and like we learned throughout the pandemic, right? So we have some assumptions. We need to act upon those, yeah. It was controversial in Germany to use masks as well. Now it is the consensus, yeah. Now I think I would see it estimate that the same will happen with tracing apps, yeah. So we have some front runners. They try to implement, and we are not the first mover here in Germany. So I think probably it's one of the first one that runs on the Apple Google API. We have seen Singapore, for instance, with the Trace Together, which did not work. Why it didn't work? Because there was no interoperability between Apple and Google. There were issues in their operating systems. They had to run the tracing app in the foreground. No one does this. Basically, it's a digital vaccination passport. Yeah? So in Android, you had issues with the data consumption, for instance, right? Right now, my Corona Warn app consumes 8% of the battery. Of course, you cannot download endless country versions of apps because then you wouldn't do anything else. But you know, let contract tracing apps operate. So I think it's absolutely important to have those discussions and to become better, right? Maybe we see in 5-6 months that Bluetooth tracing was not the way to go. So for instance, ultra waves are much more accurate, but then you have to turn on the micro. That, of course, this raises different questions as well in terms of data privacy. So I think we really need to execute on those issues and learn while executing and adapting, right? So, and of course, if there is a position that you want to be the second mover and you want to evaluate first results, of course, this is something I can truly understand. Now, we see the first results coming in and we try to help, right? No one knows if this will really work out, right? We can tell you, I think from now on in 5-6 months, because initially this was planned really to enable the ease of the lockdown. Now it's a shield against the second wave. If you are in a country like Austria, for instance, with 20 cases per day, or in Germany, we have 300 to 500 cases, the probability that you are going to be warned by using the app is very low. It would be different though, of course, in some hotspots in Brazil, for instance, or in the US, in New York a month ago. Then of course, it makes really sense in order to support the manual tracing efforts, because they are of course also loaded with work with their work load in the current crisis. So I think therefore it's important to understand it's complementary, right? You need to work on the Apple Google API. It's not a turnkey solution. You still need really to adapt this to your local circumstances. Also, of course, we have the GDPR, we have the European legislation, but we also have national legislation. And this needs to be taken into account. And also, you need to invest a lot of effort to work with the community. It's not just you'd call it a shot and then you put everything in open source and that's it. We have very intensive interaction with users, and we have a full team just answering their questions. But they're not only answering questions, they also have great proposals on how to improve and make this whole data privacy is something that usually you develop and then you go to someone who certifies, and then, okay, everyone is fine. In this case, we really invited our federal data privacy authorities to sit with us at the development table and to go through various iterations, because we simply haven't had the time to go through the whole certification process. And this would also be our appeal now to public sector, to European institutions, to national institutions, to embark with us, with business, but also with startups, with the digital community on this agile way of trying to solve those problems, right? And we might go wrong, and sometimes we are right. We try to do our best, but let's do it together as a team.
Thanks, Martin.
But, Evie, may I ask something to Martin? Would you advise the Lieutenant Governor, in addition to the excellent program they have in place to support manual tracing, to consider adopting Real Fast as a complementary measure, a tracing app? Or do you think it would be wise to wait for a few months and learn from our and other experiences before she decides to do so?
So I would advise, our offer, of course, would be to set up a technical workshop, also, of course, with great pleasure together with the European Union, to share our hands-on experience, how we tackle the challenges, and have not just a panel discussion, but a real technical discussion, right? And then also, because Apple and Google are all based in California, we could tie them in as well. So we could make a collaborative meeting and a collaborative effort between California and the European Union out of this. I would be more than happy to support such an exercise.
Great question.
Thank you.
Thank you. Thanks, Martin. So conscious of time, I think I have one more question for Kuba, and then we're going to have to turn to concluding remarks. So Kuba, in the guidance, you state that the apps should be deactivated and deinstalled once the pandemic is considered to be under control, and that's not dependent upon the user. So how does that work in practice?
Yes, I would say we don't know yet how in practice, because we are not yet there. I mean, but ultimately, as I said, what was very important, that also from the point of view of trust, that ultimately the authority who is in charge are not, digital geeks. It's not, people from digital ministries, but these are the health authorities of the countries. They are ultimately taking the decisions which are based on the latest epidemiological guidance. So it's basically in their hands. So as we, but we expect that this would be, we are far from it at this stage. That I think, as it was said, and I very much want to stress what Martin said. It's we are, participating in a one big experiment. We have high hopes, but we still don't know how it would work, and we have to be extremely flexible, innovative, and adaptable to make sure that indeed, we can be effective in containing the spread of pandemics. But this idea of automatic the installation has been widely agreed, and this is what we expect. Health authorities will ultimately, push this symbolic button, once this is over. I wouldn't say it's under control once it's over.
Yeah, that makes a lot of sense. I think there's still so much that we have to learn, and as the ambassador said, I think we'll be learning over the next couple of months. But it's certainly true that this type of innovation can save lives. So I think it's a very important discussion to have. I want to turn to all of the speakers and just ask one final question, which is if you could have one thing, or if there was one thing that would make the situation better, with whether or not that's technological advancement or a change in the policy landscape, what would you ask for? And I'm going to go ahead and start with Jared.
Yeah, certainly. One thing I would ask for is that even though it originated in the 1970s, is that we look back to the 3 key things in the Belmont Report when we think about what is appropriate. It's respect for persons, it's that autonomy of the user, it's beneficence, ensuring that we minimize harm and maximize gains, and the justice, that we equitably distribute those gains. It's interesting to see how even as technology advances, those same 3 principles are a fantastic underpinning and foundation for how we develop solutions of the future.
Thanks, Jared. Lieutenant Governor, I'm going to turn to you next.
Well, let me just reiterate that we are watching very closely what you're doing in Europe. And so as your experiences begin to bear the kind of information that will help us answer the question about what these kinds of contact tracing apps could do to support the manual work of our California Connect program. We really look forward to seeing the results of all that. But what popped into my head, Evie, when you said if you could ask for one thing right now, we need our people in California to wear masks. And this is like the lowest tech part of this entire process, and the science is so clear. So we do have a long way to go in helping to convince our people in this world where there's so much information. It's so hard for people to know who to believe and what to believe. The challenges of technology have created in part that environment. And so we definitely have some work to do in helping our people filter through all of the information that's out there and really be able to know what the facts are, what the science is, and what is the most important information that they should rely on for their decision making. And we have a ways to go to get there.
Thank you. Martin, any thoughts? And you're on mute, Martin.
Sorry. Yeah. In April, when we saw the horrible pictures in Italy, as a European, I think I was really shocked to see how Europe disintegrates and how Europe fails. I think in the meantime, I think we're starting to get our acts together, right? I do believe that, for instance, if we can provide interoperability with the Italian Immuni solution, it would be the right step, so that we could also enable German tourism to Italy again, but that we also join forces with the European Union Commissions, with member states, really to explore further use cases on how digital technology this is part, of course, of the strategic program as well of the German presidency, which has started yesterday. How can we collaborate in order to find solutions as a team for Europe in the future? That would be one of my key asks going forward, that we do not forget all about this in 2 or 3 months, that we start to build on top of it.
Thanks, Martin. Kuba, your thoughts?
Yeah, I realize I actually would like to say probably something quite close to just Martin has said. You know, the starting point was that basically in the area of health in Europe, it is basically considered national competence. So what was happening at European level was very, very limited, you know. And what I would really love to see, that this realization that we actually are dependent on each other much more than we have ever realized, that this is actually carried towards the future. So now Commission has basically proposed a month ago a new massive budget with the special kind of recovery funds. And also there is a brand new program that we have never had in Europe, 10 billion euro for health, including very big chunk for digital transformation. So if this moment, I would just simply love to see this momentum staying with us and really indeed being much more prepared if such things will come in the future. And I think that would ultimately gives a sense of people that they are together. And obviously, I'm totally talking about EU, but that also means, you know, international cooperation in the context of WHO. I mean, it means we have to take it to basically to a next level. Thank you.
Thank you. Ambassador, I turn to you if you have any final thoughts before we wrap up.
I think that the point raised by a number of people is absolutely right. The reason why in Europe we realized that we simply had to work together on health and on this crisis. Also ties into the fact that one of our biggest achievements, in fact, as European Union, is the Schengen area, the open borders. And we realize that unless we manage to coordinate our approach to this, from procuring PPE together in the open market, so we don't have 27 member states fight against each other, but we could do something collectively, to working together to in a collaborative way, also with the WHO, with our American partners, others, to find a virus, to find a vaccine, to find treatments. That all those things affect the integrity of the European Union soul, which is the freedom of movement. And when you look at it in this way, what we've done after the initial confusion in the EU has been quite remarkable, including the funding that was just mentioned. But let me also close with what Lieutenant Governor Kounalakis said. Sometimes there's a magic, in things like these. They're nice, they're big, they're magical, and we think about the apps and all these things. But sometimes, going back to the basics makes a lot of sense. These contact tracing apps can make a huge difference, and so our support, trying to coordinate also the cooperative, principle-based environment through what Kuba was saying, to make sure our member states can do this together and not everyone have their own thing going on, is huge. And at the end of the day, you have to wear their masks. You have to wear a mask. You cannot not wear the mask. I mean, maybe the mask is also not a silver bullet. I mean, we know that some masks, catch more things than other things, but the fact of the matter is you probably don't need anything as sophisticated as 1,000, technological innovations if you just do the right thing. Avoid going out with, a lot of people, being too close to them. I know it's annoying, and certainly for us Europeans with our open borders as a big badge of pride, it's particularly frustrating at this stage. But we have a really aggressive virus. We have seen how in Europe we've managed to take the curve from up there to down here by social isolating, by wearing the masks. We have to keep doing that stuff. Manual tracing, as California does, is not substitutable. Everyone said here, I understood it correctly, that anything else you may do, you cannot go away from the basics. So let's remember the basics. And let's work together, Europeans and Americans, in this. Also when it comes eventually to all the values that we have been discussing here. Privacy, making sure we are anonymized, making sure we're not centralized in one database. All these things, as I said at the beginning, may be concentrating a discussion now on contact tracing apps, but they're basically a question and a requirement for any single AI application of the future. No one has set those standards yet. There are some governments out there who don't share our values, who don't think privacy is important, who don't think that citizens should have a say, who think that all these things should be centralized, decided by some government out there, usually an authoritarian government. And there are people who are struggling, as in this discussion, with the minutiae of those details in a democracy. And at some point or another, those questions will come to 1,000 other apps that have nothing to do with health. And unless Americans and Europeans are together, holding hands, putting their brains together, we will not be reaching our potential. So I think that what Lieutenant Governor said, if there's one thing I take out of this discussion, if we can set up some kind of a technical discussion with California and Europe, given California's huge weight in technology and in size, to see how effective our apps are, how effective your apps are, Eleni, and your processes, and to learn from each other, we could make a huge difference. I'd be more than happy to help set this up if this is what everyone desires. Congrats again, guys. This has been an amazing discussion. Thank you so much.
And with that, we're concluding today's webinar. So thank you to our speakers. Thank you to everyone who joined in. And we hope to engage with you again very soon. Thanks very much. Have a great day.
Thank you very much. Bye-bye.
Bye-bye.